So we look at another interesting part of prioritization. That is the Maslow's hierarchy of needs. It's a pyramid of needs, and it's guiding us to always prioritize the physiological needs. So when we see the Maslow's hierarchy of needs, we have the physiological needs of your client. The client is saying, I'm warm, dry, fed, and rested. So the physiological needs of the client is a priority. Then the safety and security needs, love and belonging needs, self-esteem needs, and then self-actualization. So this serves as a guide. And always remember that physiologic needs have to be met first before the other needs above this triangle. Please take note. So see to the physiological need before safety and security, love and belonging, self-esteem and self-actualization. So self-actualization becomes our lowest priority to address. So we would always have to arrange it when you see a scenario, and then you can fit it into safety needs, you can fit it into physiological needs, you can fit it into self-esteem needs. That will help you to be able to choose the highest priority. And always remember, physiologic needs first, followed by safety, comfort, psychological needs, that is a problem within that person, the social needs, problems with other people, and then the client's spiritual needs. So let that serve as a guide. Let's use this case to understand the Maslow's hierarchy of needs. So we have a client who has chronic kidney failure. This client has hyperkalemia. Remember, that is an electrolyte imbalance. And client is complaining, it looks like I slept on my arm, and then I have some pain in my left arm. And then he's also telling you that he's so worried. He lives on the 10th floor and fell last week on the stairs, and he's afraid that he will fall again. And he's also telling you that this diagnosis of chronic renal failure, he will not accept it. He's denying the diagnosis because he's a committed Christian, and he's so disappointed that despite that he has this condition, despite his strong faith in his God. And he also complains that his family rarely visits him. So most of the time he is lonely. So we're supposed to group all of these needs and prioritize them. So let me help you out with that. So the client had hyperkalemia. That is electrolyte imbalance. That is a physiological need. We have to fix the electrolyte imbalance. The client lives on the 10th floor, is afraid of falling. So the fall fits into the security and safety part of this triangle. And client is complaining of pain in the left arm. He slept on the arm, he says. But addressing that pain is to give him some comfort. And then he says that I'm never ever going to accept this diagnosis. That is a psychological aspect of this client. And his family rarely visit him. That is a social aspect. And then he's disappointed that he's a committed Christian, but he still had this diagnosis of chronic renal failure. That is part of the spiritual needs. So if you're supposed to arrange this, you use the Maslow's hierarchy of needs. Address the physiological need first, electrolyte imbalance. You're not going to say, I'm going to solve the pain in the arm, whilst the electrolyte imbalance can kill this patient. You're not going to say, I have to work on getting your family to be involved in your care. That is way down. So please, this is how you're going to apply the Maslow's hierarchy of needs in your prioritization. Physiological needs will come first, will be solved first, as you see here. Safety needs will be solved first, as you see here. Love and belonging. I want to belong, have my family around me. Self-esteem need, self-actualization need. So I hope you are getting the Maslow's triangle hierarchy of needs. Let's look at this question to understand it better. Maria, a 47-year-old patient, underwent open heart surgery 24 hours ago. You are her nurse and you are monitoring her post-op recovery. So during rounds, she had several concerns, and you have to decide which of them you are going to prioritize. So the patient says that she had an external incision and she's worried, how will it look like when it's healed? So that is the cosmetic part. She's worried, how is it going to look? And the second one is complete teaching the patient regarding sternal precautions. So the precautions that she will take in the sternal area to prevent complications. And then C, you also want to ensure that she will have physical therapy as soon as possible to prevent any injuries. And D, you also realize she has mottled, cool upper and lower extremities, and the capillary refill time is prolonged 4 to 5 seconds. So which of these will you prioritize? Let's give our answers. Yes, Nancy says D. Great. Well done. You got it. So D, the client had open heart surgery. So it could be that the cardiovascular system has been compromised and not enough blood is being pumped into other parts of the body, including the peripheries. So now the upper and lower extremities are cold and mottled, and the capillary refill time is increased. So we have to attend to that first before we worry about how the scar, the cosmetic appearance, how the scar is going to look. That is more of self-esteem. So how the scar will look is more of a self-esteem need. So our answer will be D. Well done. That is the basic physiological need here, and we have to prioritize that. So the standard precautions that we'll be teaching will be more of safety to help the client so that the client will not have any complications. And then ensuring that the client goes through the physical therapy to prevent any injury. That is also a safety issue. And then the client's concern about the scar, how it's going to look. More of self-esteem need is way up here. So that is a lower priority. So I hope we have gotten the Maslow's hierarchy of needs, and we will be able to apply it in our prioritization. Are we good?